Well, in Washington, a new week brings a new push to pass legislation to shore up the cost of health care that you pay in the United States, as those tax credits under the Affordable Care Act will expire on January 1. Of course, the impact, more than 20 million Americans could see their health care premiums skyrocket. House Republicans have released a package of bills that they say will fix the problem, but they stop short of reinstating the ACA tax credit. So you see who we have here live on Capitol Hill. That is congressional correspondent Caitlin Huey-Burns. Caitlin, last week ended. You and I were talking about it live right here on CBS News 24/7. Both the Republican bill and the Democrat bill both went down in flames. So what's the ground game now going into this new week?
Hey, Reed, it's great to see you. Well, this is the last week that Congress is in session for this year. They will leave town Friday for the rest of the year, not to come back until early January, right after the new year. So this is really crunch time. And just to give you, not to bury the lead here, but you are not likely to see any way to address these rising premiums that are set to go into effect at the beginning of next year, because Congress just won't be able to have the time to figure this out by then. This week, the House is going to take up legislation. That legislation does not extend those health care subsidies, Affordable Care Act subsidies, but it does include some measures that they believe are addressed to address rising premiums. One proposal is to allow small businesses to pool together insurance. Another proposal aims at addressing the rising costs of prescription drugs. There's also talk of putting an amendment to this package to extend those Obamacare subsidies, but it is unclear that that would have enough votes to pass through the House. But Reed, I should note that even if the House is able to pass some, substantial measure here, it is unlikely that the Senate can take it up and also push it forward in time, let alone pass it through the Senate. So you're really looking at healthcare costs starting to rise at the beginning of January. And this is a problem for both parties, especially heading into the midterm elections. Right. This is essentially a live political football, but many Americans are left hanging in the balance with no solution here.
Well, we know that while the House tackles health care, senators are focusing on that $900 billion defense spending bill. We know there's really not a lot of bipartisanship where health care is concerned. Are you seeing that where the military spending bill is concerned? Yeah, Reed, this defense authorization bill is one of the rare times that we see bipartisan support for major legislation. We tend to see this every year. It tends to pass every year with bipartisan support, and it will likely pass through the Senate after passing through the House last week. What this would do, this is nearly $1 trillion in Pentagon spending, as you mentioned, nearly 1,000 pages of Pentagon policy directed by Congress, and a lot of it codifies executive orders that the president issued. This will now be Pentagon policy. Reed, I should also note, as we're talking about the Pentagon, we have some news this hour. Chuck Schumer, the Senate minority leader, the Democratic leader, said that Defense Secretary Pete Hegseth and Secretary of State Marco Rubio will come up here to Capitol Hill tomorrow to brief all senators on the strikes on those boats in the Caribbean. You remember, we've been talking about this for a couple of weeks. A lot of questions regarding that second boat strike on September 2nd. You had some briefings with top members of various committees. Well, tomorrow, all senators will be given that briefing. This comes at the urging of Chuck Schumer, and he just posted a little while ago that he did that request will be met, and those briefings will happen tomorrow. So as we're talking about Congress outlining defense policy, they're also wanting some more answers from the defense secretary himself. And you're chasing those answers, and we appreciate it. Caitlin Huey-Burns, CBS News congressional correspondent. Always great to talk to you.